Chapter 14: How Psychosocial Factors Affect Health Behavior Source. Introduction to Public Health by Mary-Jane Schneider. Jones and Bart learning behavior matters in public health, but behavior is shaped by more than individual willpower. In this video, we'll explore how psychosocial factors like stress, social support, and socioeconomic status influence health behavior, and how public health can use psychological models and environmental change to promote healthier lives. The social context of behavior. Humans are social beings. That's why changing health behavior often means changing the environment around it. Certain groups consistently show higher rates of disease, not because of biology, but because of social patterns. The most powerful predictor of health, socioeconomic status or SES, a combination of income, education, and occupation. SES and health disparities. Low SES is linked to higher mortality, more chronic disease, and less access to care. But race matters too. Even among people with the same SES, Black Americans face higher death rates than whites. The Whitehall study in the UK showed that lower job rank, even with equal medical access, meant higher mortality. Why? Stress, nutrition, housing, and discrimination all play a role. Stress and so-support stress affects both the body and behavior. It increases heart disease risk and weakens immunity. Major stress events like losing a job or a spouse raise death rates. But even daily hassles like late rent, unreliable child care, or discrimination can wear us down over time. What helps? Social support, friends, family, and community networks can buffer stress and reduce mortality risk. Health belief model and self-efficacy psychological models help us understand behavior. Health belief model says people are more likely to act if they feel vulnerable, think the condition is serious, believe an action is effective, see few barriers to action. Self-efficacy, the belief that you can succeed, also matters. Without it, people feel helpless and stop trying. Programs that build confidence, like peer-led drug prevention, are more effective than simple lectures. Transtheoretical model. The transtheoretical model sees behavior change as a process with 5 stages. 1. Pre-contemplation. 2. Contemplation. 3. Preparation. 4. Action. 5. Maintenance. Knowing a person's stage helps guide support, like moving a smoker from thinking about quitting to actually quitting. The ecological model behavior is shaped at many levels: intrapersonal, knowledge, attitudes; interpersonal, friends, family; institutional, school, work, community, local networks; public policy, laws and taxes. Ecological models show how these levels interact and how interventions can target them all for better results. AIDS prevention case study. In the 1980s, San Francisco's gay community launched a successful AIDS prevention campaign. They used health belief model, personal risk, response effectiveness; self-efficacy, confidence through skill building; ecological approaches, peer education, bar outreach, policy change. It worked, risky behavior dropped dramatically. But later, complacency returned with new treatments and high-risk behaviors rose again. Lesson: health promotion must adapt and persist. Environmental and social change. Sometimes it's easier to change the environment than the individual. Examples: safer roads reduce crashes more than driving tips. Accessible produce improves diets more than food pyramids. Needle exchanges reduce HIV among drug users. The best public health outcomes happen when communities, not just individuals, are supported to be healthier. Conclusion: public health behavior change works best when we understand how stress, support, and SS shape choices. We apply behavioral models like health belief, stages of change, and ecological theory. We support individuals, but also change environments. Behavior change is not just about willpower, it's about opportunity, equity, and support. Call to action. This video is based on Chapter 14 of Introduction to Public Health by Mary-Jane Schneider, 6th edition. If this helped you understand the psychology of health behavior, share it and comment. Which behavioral model do you think is most useful for public health?